Strokes, aneurysms, and arteriovenous malformation are a type of non-traumatic brain injury, which does damage by interrupting the circulation to the brain. And these are amongst the leading causes of death in the United States and around the world. These types of disruptions of blood flow to the brain are marked either by an ischemic event, and in this case ischemia means a disruption of oxygenation by a blockage, or by an aneurysm, which is basically a blowout, almost like with tires, where the blood vessel wall, the arterial wall, balloons out, leaks, or literally will rupture, and arterial blood will flow into the brain matter itself or into the spaces around the brain, the meningeal spaces, and will put pressure as well as deprive the brain of oxygen and nutrients and interfere with the transport of nutrients around inside the brain. And whether it's an ischemic brain injury, a brain attack, a stroke in that sense, or whether it is a hemorrhagic stroke, both of these can cause devastating disabilities, and both of them require immediate emergency interventions. Again, as with traumatic brain injuries and other types of brain injuries, you need to act quickly, you need to act fast, and this is the acronym FAST that is used to determine, at least initially in first aid circles, whether somebody's having a stroke. Well, you look for problems with facial droop, whether the mouth droops and the eyelid droops, the eye droops, whether they have problems with speech, whether they are having trouble saying a phrase, whether they're having motor problems with their body, and you have a limited amount of time. So call 911 right away. You want to get them to the emergency department and an appropriate stroke center that is capable of intervening. And in case it is a bleeding aneurysm, they need to go somewhere where they have neurosurgical intervention. And so you need to call 911. That's your best intervention, because they can make sure they go to a stroke center. And it also helps to know which hospitals have, which are a stroke center. Symptoms from strokes and aneurysms and AVMs are, again, that facial weakness, problems of coordination, oftentimes speech defects, which are problems with understanding. They may include personality change and irritability. They may include confusion, problems walking, problems with movement, sensory problems, thinking problems, just executive problems, planning, organizing, coordinating, specific academic problems, memory, a broad gamut. And strokes are a complicated disorder, whether they are hemorrhagic or non-hemorrhagic, and are one of the most significant causes of non-traumatic brain injury. So welcome to the site, and hopefully you'll find out information that is useful here.